Your posters are great. It shows some wonderful work. Your professional practice model is beautiful. I love the imagery and the way you're illuminating the real purpose of our work, and that is to hold the people in our care, but I would suggest also each other in order to do the sacred work that you do every day. And so what I hope to talk about with you today is why the human connection is so critical, not only to the care of patients, but ultimately to the care of ourselves and the satisfaction we get in working in intense environments every day. And that's the truth. It's been that way, by the way, for 40 years. Every year was the new Whitewater year. So I can tell you it continues to be complicated, intense, challenging, and we keep showing up. What's that about? I think we keep showing up because we want to and appreciate. I'm just not doing tech well today. Okay, I have to do that. Now I've got that and I've got my mic, we're good. That human connection and human satisfaction, or compassion satisfaction, are intricately related. Because, this is not going to go well. Could you hit the, thank you. It's all grounded in knowing to love what we do and to know that it matters really is, there can't be a more profound joy. Do you know a lot of people go to work and wonder what difference they're making in the world? And we really have it served on a platter for us. We know that every day we can touch someone's lives and we can be open to being touched by theirs in return. And that's quite a gift. Let's go to the next slide. Robin Youngson is an anesthesiologist in New Zealand, and we've met online. I mean, in the most professional sense of the word. He's, that didn't sound right as I said that. But he has an organization called Hearts and Healthcare in New Zealand, and he's an anesthesiologist, and he's going around the world talking about how critical compassion is to patient care. And I was quite intrigued by that because he's, certainly a scientist to the core. And I'm going to share a little more of his work as we go on, but he really links the science of compassion to health and healing in a great way. But he said compassion is the calling that brought us into the healing professions. That it was about knowing suffering and wanting to do something about it. That we knew that we would be walking into the lives of people who were suffering, experiencing pain, and we did it anyway. Henri Nouwen has a beautiful quote that says the same thing. Anyone who enters the pain of a stranger is a truly remarkable person. Just take that in. So I think we begin to see our work kind of as what we do every day. I've heard people say, well, it's just my job, or heaven forbid, I'm just a nurse. No one in this room says that, do they? Anybody say I'm just a nurse? Oh, good. Because there's nothing justa about it. It's truly remarkable work, and work that touches the lives of patients in ways that are profound and everlasting. So what's your impression of these student nurses there? Or they're really about to be graduate nurses. Does that feel familiar to you? I came across this picture, and I will confess I'm the one in the front. I was bright-eyed, bushy-tailed, and believed that I was about to embark on a profession that was absolutely magical. I didn't grow up wanting to be a nurse. I was an older than average starting student. I was influenced some by a wonderful sister-in-law who worked as a night supervisor at St. Cloud Hospital, and over wine over a kitchen table many nights, she would talk to me about the people she cared for, the families who were in crisis, and the way she made a difference. But what influenced me is not even her stories, but how held I felt by her as I listened to her stories. And I could see that she brought the gift of herself, her presence, to the care of these people she was telling me about. And I thought, I think I'd like to try that. So at the age of 22, I enrolled in a community college in Central Texas and began a journey that absolutely catapulted my life into something I could never have understood. It wasn't easy. I was married. I had a child. My husband was in Vietnam and back, and I had to change schools. And I won't go through the whole story, but it took me a while to get there. But I've never regretted it. I've never stopped loving the magic and the practice. And I think it's really informed the way I've approached my work as a whole. I did look a little younger there, but other than that, the energy is the same. So one of the things that I noticed then, I was really blessed to have some great instructor, is that the human element of practice was very important, and it could get lost in the stuff of practice, the doings, that are also very important. The technical skills and the technical knowledge that we bring to patient care is critically important. But somehow there was the sense that the therapeutic aspect of care either happened or it didn't. You either had it or you didn't. Some were really good at caring, others not so much, but they're really, have you heard about really a good nurse or really a good doctor, but a personality that only a mother could love? Well, I thought, if I'm the patient in the bed, I don't want to draw the straw of the person or the physician, nurse, other caregivers that are taking care of me. It's just not really believing in that, quote, touchy-feely stuff. Felt like it was as critically important as the technical skills. But if we never talk about it, and if we have a hard time teaching to it, and a hard time, therefore, engaging and modeling, it'll always be elusive. Then I came across some literature that really struck me. This was about, 8 years ago. An article that said nurses don't have time for therapeutic relationships any longer because healthcare is too fast-paced. And so that was something that was taught in the old days, which would have been the days that I grew up in nursing. But it really can't be expected in today's fast-paced environments. And then there's also the rumor that the younger nurses just aren't into it, which, by the way, I absolutely say is not true. I see it throughout the country. The compassionate care and the compassionate calling is as strong as in the young generation as it was in the older generation. But if we don't nurture it, if we don't teach to it, then how can we expect it? And we value what we see as important. So I thought it was time to revisit it, and that's what my work has been about for the last 10 years, and I'd like to share a little bit of that with you. I started by defining and differentiating the purpose and nature of a therapeutic relationship. And while therapeutic relationships result in high levels of patient satisfaction, the purpose of it is to promote well-being and healing in the patient, and the satisfaction is a byproduct because people feel cared for. So promoting well-being is the first purpose. The second is to ease suffering, which is, of course, why we've gone into this field to begin with. The third purpose of a therapeutic relationship is to help the patient and their family cope with what they're dealing with. You do that every day. The fourth is to foster understanding, help people think through or express, what does this mean in my life? What might it mean when I go home and have to now deal with this new circumstance in my life? So we not only educate, we foster understanding through therapeutic presence. And the last is to support ownership, to really facilitate greater adherence and care for themselves. I read a definition of nursing in a book called Kindness and Care. And I was really struck by this and thought you might appreciate it as well. This nurse said that he really is an instrument of caring and safety, that's a core purpose of his work. He says nursing is sometimes simply being there, listening, providing reassurance, keeping people safe until they can keep themselves safe. I love that. We keep people safe until they can keep themselves safe. And then he said, nursing is catching the bad dreams until a person wakes. Isn't that gorgeous? Nursing is catching the bad dreams until a person wakes. So, all of that is mystical and reverent and sacred. It's why we're doing this. But do we need to get clear about how to do it? Well, Michael Trout, who's a psychologist in infant mental health, a colleague, and I will confess he's also my husband, because that always gets out, and I decided that we could collaborate and help to demystify what it looks like when we're connecting therapeutically in fast-paced, fast-moving cultures and environments, which is what we're always doing. We don't have an hour and a half to sit with someone and help them cope and facilitate understanding. We need to do it in the moment, on the fly, and making every moment we're with them count. So what would it look like if we were to do that mindfully? If we really are paying attention to how we are in each moment, what would that take? And would it be a tool set that could actually help us as clinicians, not add yet another thing for us to do? That was a really important purpose of this work for us, is it's not about saying, now do this too. It's about how can I integrate this way of being and interacting in a way that is efficacious for me and the patient as well. And so one way we thought is to deconstruct it, which we did. Instead, human connection happens when we attune, when we wonder, follow, and hold. Those are everyday words in some sense. We wanted them to be language that could be used with ease, and yet also language and definition that can help us both be mindful, intentional in the moment, and if something isn't going right, being able to step back and say, gee, I wonder what I need to do here. I know, I need to attune, because when I came into this room, I had 900 things on my mind, and this person perceived that, and that's why we got off to a rocky start. So let me reset here. So mindful practices and processes that you can take with you to any room, any moment, any time. So I'm going to define those a little more clearly for you. Tuning is the doorway to human connection. I can tell you a patient and or their family can tell if you're attuned to them within 3 to 5 seconds, even less. Some of this I've learned through my own experience as a family member. I have a daughter with a chronic illness who's going to be 30 soon and has had 2 kidney transplants. So you can imagine the story behind that. We've been in lots of complications in between both. So we've been on the other side of the door a lot. And so I had this little working laboratory, whether I wanted it or not, and I could see that. I could see that she could tell within moments whether somebody had her back or not. And having her back means they're tuned into her, not distracted with their task list and other things. Well, let's be real. Sometimes we're distracted, right? There's a lot going on. And so the practice of attuning is really remembering that what might be routine for me is not for the person in this bed. That they are incredibly alert, vigilant, because their lives are in our hands, so they're noticing everything. Whether we are distracted or not, I cannot believe that. That beautiful music is my telephone, which I thought I turned off before I came up here. But it is pretty, isn't it? It's kind of... So attuning, it's knowing that somebody has your back. And How do you do that in the rush of the moment? I'll bet some of you have practices right now. The number one practice I suggest is taking a pause at the door before you walk in, breathing in and breathing out. And in that simple, mindful practice, breathing in and breathing out, remembering that I need to be present with this person right now. Attuning is an action. I've been using the example of like tuning into a radio, and someone reminded me the other day that no one does that anymore. So I was thinking, well, when we have the spinning thing on the computer, when it finally stops spinning and you're clicked in, that's when you're attuned. So tuning in is an action of focusing on the other and making them your priority in this moment, at this time. It's moving into a physical, mental, and emotional position to pick up on what's going on with the other person. And it also allows you to connect with them right where they are. So it's an in-the-moment practice. It's quick, it's tuned in, it's remembering they need to know I have their back, that they're the one that's important right now, and I'm going to connect with them right where they are. And it brings a positive energy. Attuning, I'm getting mad at this thing and now it's going to bounce back at me. Attuning is a thing you can do which will help you actually be. We talk a lot about presence, don't we? And it's foundational to you. Has anyone else in this room struggled with being present? Raise them high. Thank you. I have. Sometimes I almost felt like I was going present. Attuning is action-oriented. It's really helped me notice where I am emotionally, physically, and to kind of actively tune into the other, focus in, look at the other's eyes, look at the other's face, and it helps you then to actually be. So it's a very practical action. It also, without attuning, connection doesn't happen, relationship doesn't happen. And I think you end up wasting time. Because what we know to be true is when people feel unseen, which happens if we don't attune, what follows feeling unseen? Feeling unsafe. When we feel unsafe, what happens next? We feel more anxious. When we feel more anxious, then the flow of the care doesn't go in the way the patient would want it, but also doesn't go in the way the clinician wants it. So attuning is a very efficient, in-the-moment practice. The next two practices we named wondering and following. Wondering is an act of being curious and open, being genuinely interested in the other. Now that seems like a no-brainer, right? Of course I'm interested in the other, but I can again say, when you're caring for lots of patients, lots of time, and you're seeing the next admission, the next patient, it's not an automatic. We can get involved in our process. It's a mindful practice to say, I am going to be interested in you, not what your diagnosis is, although that's important information, but I want to see you in this moment. People can tell whether that's happening, and it helps us to open to new information. It's based on a belief that the patient always has something to teach them, and without it, we couldn't do our jobs as well. And I was reading your website last night, and I thought, oh, this is it. This is wondering. We take the time to get to know our patients better as people so we can treat them better as patients. That's it. That's why this is so critical and why we have to be mindful about it, or it's easy for us to go into automatic and think we already know. And it's also remembering that everyone has a backstory. Now, why does that matter? If we remember that everybody has a backstory, we can take less personally the strange behavior that we may be seeing in front of us right now. Those patients that are kind of concerning or difficult for us to connect with, remembering that it's not about us personally, that it's something in their story, in their life that we're seeing in this behavior, can help us be curious about it rather than moving to judgment, which is a pretty human place to go. Following is an act of it's closely connected with wondering, but it's different. Because once we wonder and inquire and want to learn about the patient, following requires us to stay with it long enough to actually hear the person's perspective, to listen to what they're telling us, and then to integrate that into our care. If we haven't done that part, we haven't completed the cycle. Doesn't that make sense? It can be everything from asking somebody to tell you more about what you're hearing, so you're actually getting the full impact, because it's important to their care, you realize that. It can be just empathizing, just a sound. What people have told me when they talk about following that worries them is that they could get stuck, right? If I start listening, how will I get out there? And there are ways that we talk about how to do that and set boundaries. But also, sometimes there's nothing to do about what you're hearing. And that's why I emphasize the power of listening and empathic sounds, or that gentle touch that will tell somebody that I get it, I can see what you're going through, and I see that. There may not be action to take about that. And then the last practice is called holding. So if we're attuned, if we're really clicked in to the other person and they get that, they know we've got their back, we care enough about them to pay attention, and we've been interested in them by wondering and we're following, they feel held in care. And I'm going to give you some examples about that, but that's what patients tell us. That is the magic sauce, that you're focused on me, you've listened to me, and you're actually interested in me and my perspective. Then holding results from that. Holding is also an act of devotion. It's a conscious decision to affirm and dignify what we've learned from the person. We create a safe haven for them, and I'm going to give you some examples here in a minute. And it's also what I call a moral commitment to protecting and preserving human dignity. And that's really at the source of it all. That's at the source of emotional safety. That's at the source of compassionate care, that we're preserving human dignity and that we would never reduce a person to the status of object. And I'm just going to tell you real quickly 3 ways, and we all do this, by the way. This is, again, about consciousness. It's not about, oh my God, I do that, so I'm not a very good person. We all do it. It's a way of understanding what we do. One way we objectify someone is feeling like what they have to tell us is irrelevant, or therefore they're irrelevant. Or that if I listen to what they're telling me, it's just going to create an obstacle by day, so therefore they're an obstacle. And the second is I just need to get them to do, or third, I need to get them to do what I need to get them to do, is seeing them as a vehicle. When we see a person as a person, what they say, what they think, what they feel matters as much to us as how we think and what we're saying and what we feel. So it's a pretty important differentiation. So holding, in summary, asks that we attune, wonder, and follow, that we maintain a focus on the person rather than the work, that we keep confidences and safeguard privacy, that we defend against any who would convey disrespect about the person in words or actions. So it's like being a fierce mama grizzly, I like to say, or papa grizzly, that we are safeguarding the patient from any kind of disrespect, even indirect, and that we assure safety and quality. All of our technical skills, all of our knowledge that we bring to the care is part of our ability to hold. It's absolutely essential. So they're intricately related. So this is the summary of the practices in a visual for you. Tuning is tuning in to both ourselves and the other. Wondering is to be truly interested to learn about the other because we believe that's important for us to do good care, provide good care. Following is to be led and taught by the other, and holding is affirming dignity and creating a safe haven. So they're simple. They're simple, and we can hold them in the mind, and they can come to our aid when we're in the moment. That is our hope and purpose for this work. So I'm going to bring it forward with a reflective piece here that's about 7 minutes long, and I ask you to listen to. It's called Her Name is Ruth. And my co-author, Michael Trout, is the author of this. And it, I think, brings kind of the conceptual content more to the heart. So I invite you to settle and listen to this. I'm going to stop talking for a few minutes here and ask that you talk to each other. I've got a couple of things you could talk about. One is what struck you as you listened to that recording about Ruth. And have you known a Ruth? Are you a Ruth? When are those Ruth moments in your own practice? Or maybe someone has cared for you, or someone you love, like Ruth. And then the second is, what does fill you up about your practice? What brings you joy in your practice? I'm going to ask you to just cluster with a few, maybe three, so that you can all hear each other, for about 5 minutes. And then I want to hear back from you, because this has to be a conversation, this part of our practice. This is not something that one teaches another. It's something we continuously discover with each other. So I'm inviting you to help me in the discovery. So 5 minutes to talk with each other. So we've got some folks with microphones that'll help. Let's have a little mini conversation here. So thank you. Why don't we start with just wherever you're moved to begin? I asked about what brings you joy and compassion to your own work and your practice. Those are things that we always need to hear from each other. And then any insights around Ruth, both of those are welcome, both and or whatever. So who'd like to begin? Sharing some of your perspectives on what was right up here in the front, Anne. And we're going to really work these mic runners out. So,
I think what struck me the most about the story about Ruth was this link between the human connection and patient safety. And I think about all the things that we do as nurses to make patients safe.
yes.
Like all those interventions and the things we do, but just by making that human connection is making that patient feel safe.
Yes.
And I wonder if we put more focus towards that. And, I think we still need to focus on the interventions, but putting more focus to that, making the connection, how safe our patients would be.
Beautiful. Thank you for that. That's something that really intrigues me also. I believe it would be a great area of study, because there's been some work in the psychological field that if you focus on somebody, the more you focus on them, the more interested you become in them. And the more interested you become in, the more likely you are to assure their safety. I mean, it's a natural component. So if we got researchers out here, I'd love somebody to pursue that, but thank you. That's bingo. Great. Somebody else have thoughts, comments? Over here.
Now it's working. Okay. Well, we thought that being a Ruth is really important for the patient, but also for the family, because I found that a lot of times families are just as scared as the patient, especially if it's a child or maybe a mother, for example. So I think kind of making the connection with the family as well.
Yes. Yes, thank you. That's absolutely true. It's all interconnected. Yes. And I often, as I talk with people around the country about this, when we talk about family anxiety and we really begin to dissect that, often it's because they're not feeling attuned to, they aren't feeling heard, and so then the anxiety, and they might be those people that are labeled as demanding then because they're really fearful about what's going on. Yep. Thank you. Somebody else?
As a nursing student, I think what really brings me joy during my clinicals, just having other nurses just see the passion that they really love doing what they do, and then seeing them connect with their patients and just being able to convey that to us in our learning, because that just gets us more motivated to be able to do that when we pass our NCLEX and can also convey that to the students to the patients as well.
Beautiful. Thank you for lifting that up. So it's contagious, isn't it? The more we recognize and see the beauty in the connectivity and convey that to each other, and obviously to our young who are moving into this very complex world of caring, it is contagious, and it creates a culture that is more compassionate not only for the patients but for each other. Our teams are our communities right now. This is where we live, is where we work. And so compassion begets compassion, and it makes it all more joyful. Thank you. One more comment, and then I'll move on. We have one more, because I know there's, yeah.
It made me think of our professional practice model and that sacred trust. Not only, we realize the patients are vulnerable, but so often I think as nurses we forget to be vulnerable, that, we have lives too. And we have to leave that at the door when we come in. And so one of my favorite things is when I hear patients over talking with family or friends is, that's my nurse. That you felt like you've made that connection.
Yeah.
Just like that's my patient. If someone goes in and they're, so-and-so, no, they're mine. Yeah. They're my responsibility. And so just that joint trust between each other is one of the things that made me think of.
Yeah, thank you for that. That's a moment. That is. All right, well, anybody else have something to add? Oh, one more. Yes, one more. I'm getting encouraged at it.
I think one thing I noticed with this is when you've done it for many years and so forth, when you're in a comfortable situation, it comes very naturally to you, or it can. I think sometimes when you're in a new situation or something new and you're focusing your mind on making sure you're doing things, it can be much more difficult when you're doing a new task. For example, yesterday I was working our front desk, checking people in. That's not something I normally do on a day-to-day basis. So there are certain steps that I have to follow, and I'm very focused. And I was just telling my peers here, I don't know how well I did yesterday at making that eye contact. In conversation, I think I did okay, but I think sometimes if we get focused on situations that are new to us, we have to be more mindful about this.
Yeah. Thank you. Thank you for sharing that, and a very normal kind of experience that we all have. And to reinforce what I think is so important is personal awareness. Reflecting on it, reflecting with each other about this area of our practice, so that we're able to be more mindfully intentional as we go. It's been a critical area of our practice, but it's kind of private. It's what happens behind the door, right? It's not something that it has had a segment of mystery around it. Part of what I'm hoping is to demystify it so it's not so mysterious, so that we can help. And some days you just don't even have it in you, or this particular patient just triggers something in me that I know I'm not going to be at my best. Can you help me out, peer, colleague? Because we want to make sure this person's getting the care they need, and I'm just not. I'm worn down. We have to be able to talk with each other about that in ways that are supportive and encouraging, and recognizing how complex and difficult this work can be. Well, thank you for that. I put on your tables a share your perspective with several questions on it. I thought I'd talk quicker, and we don't have time to go through them all, but I really wanted to emphasize that this work lends itself to conversation with each other, reflection and conversation. And so even though we didn't get to these today, I encourage you to have them with you, and it could be an interesting conversation at a staff meeting or something like that. I want to take a couple of minutes to lift up some extraordinary care, or exquisite care. I don't know that it's extraordinary, because I see what your practice model is. I hear your commitment to whole person, compassionate care. And I think one of the ways we reinforce it is by really looking at it, and looking at it through the lens of these practices. So Anne, if we could put up the next slide. I looked at some DAISY awards. We are partners and support DAISY. I think they're just an incredible organization. And they have all this qualitative data about how these practices manifest themselves through exquisite, extraordinary nursing care. So this award was to Bill Hansel. Is Bill here by any chance? Is he here? There he is. Yay, our own. So Bill, I'm so glad you're here because, you know, as I'm thinking of Ruth, she's a narrative, a composite that we created, but this is a Ruth experience right here, and I'm just going to highlight it and look at it through these lenses. And I love particularly that Bill is from the OR, because the OR is one of those areas that I will hear by some who are worried about being able to connect while they're asleep and we're moving fast, and what difference does it make? They don't even remember me anyway. Those kinds of things I hear periodically. But this woman who wrote in, and I love hearing it through the voice of a patient, says it matters. And here's what she wrote. Recently, I received some overwhelming news about my health and required 2 surgeries. For the second surgery, which was a major procedure, Bill came in with the rest of the OR team and pre-op, participated in reviewing what to expect, and willingly answered any questions from me and my friend who were there to support me. So you can read in this, Bill was attuned. She got that he had her back right away, didn't she? She noticed him in the group. And he was there and interested in her and willing to provide whatever information she needed. She felt that reciprocity immediately. When it was time to roll out of the pre-op room, Bill was at my side. So was Bill at her side accidentally? I don't think so. Bill was at her side because he knew she needed that kind of presence and support, that she was anxious. As we left the room, I suddenly was struck with a panic I had not felt before or expected. Bill somehow recognized my anxiety, although I said nothing. And as we moved down the hall into the OR, he remained in my eye line and gently touched me on the shoulder and hand. Bill is attuning, Bill is following, Bill is perceiving, and he's holding her in his care. In the OR, I am sure he had a million things to do, but again, he stayed at my side where I could see him and kept a connection until I moved to the OR table and was sedated. Those simple actions, staying by my side, the gentle touch and being present, allayed my anxiety and allowed me to go to sleep, reassured that I was surrounded by a caring and compassionate team that would watch over me and keep me safe. So, Bill, thank you for that. That's extraordinary. That's beautiful. And I wish we had the time to really talk to Bill. I'd love to talk more about what you were thinking, but we don't have the time, unfortunately, but we'll find you today. And what I know was inside of that was knowledge. Bill was picking up cues. Bill perceived her anxiety. His actions were not accidental. They were based on great assessment, great attunement, and a real commitment to the patient to hold and allay the safety. If you go to the next slide, I just wanted to reinforce, and was something we've already said, this was not just about being nice. This is about extraordinary safe care, because what we know is that empathic pre-op consultation based on research results in better wound healing, better surgical outcomes, less anxiety, less pain, and higher daily activities. So there's a physiological impact in terms of the quality of healing and recovery that happens through presence and compassionate care. Let's go to the next slide. This I'm not going to go through with you today. This is available to you. This is a Robin Youngson infographic that is just beautiful. And I know it's available as a PDF because I sent it in extra so that you can access these after this presentation. It's a great one to have as a conversation at your council meetings or staff meetings. Again, linking the medical viability of compassion is not just a nice to have, but is an essential to have, and why it's so critical that we support each other in growing our capacity to provide that kind of intentional care. I have one other daisy that I wanted to identify, and this is for Kelly Whedon. Is Kelly here? If she is, Somebody point her out? I guess not. This one, Kelly was an NICU nurse, and began with our primary night nurse, Kelly Whedon, holds a special place in our hearts for all that she has done, not only for Elle's physical care and mental development, but for our family as a whole. Elle is one of 2 twins who was born prematurely at 22 weeks. His sibling did not survive, and Kelly cared for the family, Elle and the family, through months of recovery. And I'm going to just highlight a couple of things. I don't have time to read it all, but the mother writes, "I'm confident that Kelly's meticulous care and extreme attention to detail is a huge part of why he is alive today." So again, a core component of holding is exquisite clinical knowledge and aptitude, so that people know that they are safe in skilled hands. And that's something she witnessed and Kelly saw consistently through the time. And she described some crises that Kelly helped Elle get through. She also said Kelly has gently encouraged our bond with Elle while honoring V's, the twin who did not survive a short but courageous life. Again, this is based on really profound knowledge. Kelly understands that helping facilitate the bond between the mother and the surviving baby is critical, not only to the well-being of the family but to the attachment, but to the baby's brain health, the baby's full capacity to develop, that it was all really intricately related to the relationship with the parent. So I'm lifting up all of the knowledge that's behind these compassionate actions that we need to recognize in each other and honor and value. One other example is that Kelly provided emotional support to me while I was at the hospital, but also over the phone during the shifts. So Kelly, that's compassionate and helped the mother to cope, helped the mother to gain understanding about what was going to be happening in their lives and their surviving baby's life. But Kelly also understood that the care of the patient, in this circumstance being Elle, was completely interdependent with the care of the family. And while that's very obvious in the NICU, as somebody lifted up here in our conversation, that is true in almost every circumstance, that the patient is returning home with the family, and the more we help the coping for the whole unit, the better the outcomes and the well-being is for the patient themselves. Donald Berwick said that I think healthcare is more about love than about most other things. By the way, I had a call from a colleague last night who's in an organization on the East Coast. Said they have 2 values. One is love, and the second is excellence. And I think that's pretty amazing. This is that love is being lifted up in healthcare. I think we've got something magnificent going on here that we need to be really celebrating and paying attention. And physician Donald Berwick says healthcare is more about love than about most other things. If there isn't at the core of this 2 human beings who have agreed to be in a relationship where one is trying to help relieve the suffering of another, which is by definition love, you can't get to the right answer here. That goes back to your comment about safety. It's all so intricately interrelated. So how does this have to do with compassion satisfaction? In the breakout session this afternoon, we're going to go into compassion satisfaction a little more, but you've lifted it up for me. Compassion satisfaction is the pleasure we derive in being able to do our work well. When we see the impact of our care and our interventions on a patient's life, that creates a level of satisfaction. And the more satisfied, the more we see, and the reason I'm emphasizing this, that it requires us to notice, because it's happening all the time. You're engaged in it, moment to moment, every day. But if we don't remain mindful, if we don't notice, if we don't lift it up for each other, we can lose it because our systems are high pressure. and that the prevention of burnout is being able to see and hold the meaning and beauty of our work central. That is it, and I mean every single word that I said. I wish we had had more time for conversation. I celebrate your work. I celebrate you. I celebrate the vision that you have for continuing to expand and become the amazing organization that you already are. Thank you so very much.